This is One-on-One. Dr. David Duncan, attending neurologist, Holy Name Multiple Sclerosis Comprehensive Care Center. Good to see you, doctor.
Good to see you.
You're here to talk about MS.
That's correct.
First of all, what is it before we talk about how it's being dealt with?
Okay. Well, it's an autoimmune disease that affects the nervous system. When we talk about the immune system, it's usually meant to protect us. So it fights off infections, scavenges for tumors and cancers. But in the case of autoimmune diseases, which MS is one, the immune system actually attacks the body. So in the case of, say, rheumatoid arthritis, it would affect the joints. In the case of psoriasis, the skin, and in the case of multiple sclerosis, it affects the brain, actually the lining on the nerves.
How does it impact the body?
People, can present with a wide variety of different symptoms. So it can be anything and probably the most common symptom is fatigue. But people can have issues with personality changes. They can have numbness, tingling, visual changes, balance problems. And that's what makes the diagnosis so difficult sometimes, is that the symptoms can be so abstract. And
is it often misdiagnosed?
I would say it's missed sometimes for many years before it's actually done.
Missed? What do people think it is?
A lot of times people, like I said, with fatigue, a person comes into the doctor's hospital and to the office and they're complaining of issues of fatigue or feeling kind of off. A lot of times, it's maybe some depression or anxiety. So a lot of times it's kind of written off to more psychiatric issues initially. And then people will present with a really demonstrative illness of loss of vision or numbness from the waist down, and then it really becomes clear that something else is going on.
So there's no cure here, right?
No cure. No, but we're looking, the real focus is to slow, initially was really to slow down the illness. I think we're getting more to the place where we're actually to put people in a form of a remission. So if we get people early and we can take and use the right kind of medication for that patient, because every person's illness is different, we're able to maybe have a strong impact.
Let's talk about how how MS treatment and medication has really improved over the past, say, 10, 15 years.
Right. So, I probably started practicing, seeing my first MS patients, regularly, maybe almost 20 years ago. And we used to say diagnose and adios, meaning that you would diagnose a patient and then basically there wasn't really anything you could offer them. You would see them when they were having a problem and then, that was it. Mm-hmm. About 15 years ago, there began medications, very early phase medications that could have a subtle effect. And then more recently, in the last 10 years, we've had a very rapid cycle of new medications. So we probably have 10 different drugs, each working a slightly different way and each one more appropriate for one patient than the other.
We know several people who have MS, but at different stages. Why does it move at a different pace in each person, or is that just the nature of what MS is in different people? Because there are some people who have had a MS and they look to be functioning on a pretty functional basis.
Sure.
There are others who are like for 10 years, 15 years, and others with MS who have had it for 5 years who can't walk.
I would say it's probably not just one disease. We're characterizing this illness based on a picture, basically an MRI scan, and we see multiple scars and we're labeling this, MS. But in reality, there's probably multiple subtypes of disease within that whole category.
It's either MS or not. Like you're making it sound.
Well, we don't have a biomarker or a genetic marker that we can actually label this. So it's based on an MRI scan. So if you look at an MRI scan and you see scars, if you see somebody with a scar on their chest, that scar could be from a bad infection they had as a kid, or it could be from the fact that they were, cut or injured for some reason. So we're seeing these scars, and we don't necessarily know that the pathophysiology. When
you say a scar, you're talking about on the brain?
On the brain. That's what this illness causes.
So the MRI looks at the brain, sees a scar on the brain, and it's not so clear cut?
It's not clear cut. So if you just see an abnormal brain, that doesn't necessarily mean MS, because MS is a progressive illness. So you want to see an MRI that continues to accrue new scars, and then you're dealing with something that's more of a progressive
So
illness.
describe your center, and is that why it's so multidisciplinary?
I would say that what I've learned over the years is that this is a chronic illness at this point, and it's important because it's a lifelong illness that you have to cover a lot of different issues in people's lives, and that comes from not just their treatment with their illness, but also physical therapy if there are physical disabilities. There are psychosocial issues if people have issues with their jobs. There's other disciplines like urology and ophthalmology that are maybe affected. So it's good to have all those different disciplines kind of under one roof to manage these patients.
There's a mental health component to MS. What is it?
For sure. Well, first of all, I mean, from the minute you make a diagnosis, there's that emotional effect of accepting a diagnosis. I mean, everybody comes with a baggage of what they were told this illness was or who they've seen in the media who's had the illness, and usually it's a worst case scenario. So you have that to deal with. And then it's the life strugglers, the life struggles with their husband dealing with it or their wife or spouse dealing with it, and the physical impacts that has on your work and your relationships. So it's a lifelong issue with that.
Why do you call it an iceberg illness?
Because a lot of times when patients have this disease, you'll look at a patient, or people look at a patient and they go, well, you look fine, because it's not really an illness that you carry on the outside as a skin disease or so forth. So people can be affected with a lot of problems internally or physically, but to look at them, they look relatively normal. And we also talk about those emotional issues. Sometimes people will have personality changes related to the illness, cognitive problems, and those things you can't really see physically. So I kind of say that those are kind of beneath the surface and not really visible to the general public.
Before I let you out of here, I'm curious about this. Are there any population or segments of the population that are more susceptible to MS?
Sure. So we have lots of different theories on why people maybe do or don't get this disease.
Does the research show one thing or another?
Research suggests that there is a genetic component, though it's not a hereditary disease. You'll see that in the general population, that's probably 0.1%. There's probably 200,000 people in the U.S. who have the illness or more, maybe 2.5 million worldwide. But when you look at patients who have MS, that if you're the son or the brother or sister of somebody with MS, you have a greater chance of having the illness. So there's a genetic component. But if you're an identical twin, meaning you have exactly the same genetic makeup, it's not 100%. So there's not a 100% genetic. There's maybe 30% greater chance if you're an identical twin.
How common? So wait a minute. How prevalent is it that someone will get MS? I'm trying to understand the numbers here.
So 0.1% is kind of the general thought of a chance of the general population. So like
one of every
0.001 of 100,000 people.
Okay. Important stuff, Dr. David Duncan. I want to thank you from Holy Name. I appreciate you coming in and talking about MS. People think they know what it is, and they don't. We don't. That's why we have you come and talk about it.
Appreciate
it. Stay right there, Doctor. One-on-one. We'll be right back right after this. Thanks, Doctor.
All right, thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Kessler Foundation, PSC&G, Johnson & Johnson, New Jersey's credit unions, Horizon Blue Cross Blue Shield of New Jersey, United Water, and by QualCare Inc. Promotional support provided by the Star Ledger, powering NJ.com, and by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.